Thank you for joining Cancer Support Community Atlanta for Oncology Patient Navigation, facilitated by Debbie Bickes, Supervisor of the Oncology Patient Navigation Program with Northside Hospital Cancer Institute. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website and complete a new attendee form to stay connected to all future programs. Welcome everyone to Oncology Patient Navigation. I'm Katie Armsby, Program Outreach Director with Cancer Support Community Atlanta. We invite everyone to visit our website, cscatlanta.org, where you can see a complete list of the virtual oncology support services available. I want to welcome our presenter today, Debbie Bickes. Debbie is currently a Supervisor of Oncology Patient Navigation at Northside Hospital Cancer Institute. She has many years of experience as a certified oncology nurse in addition to her role as a certified oncology nurse navigator. She has served on the board of the Metro Atlanta Oncology Nursing Society as treasurer, president, past president, and is currently the advisor to the board. She also serves on a national committee for the Academy of Oncology Nurse and Patient Navigators. Debbie has authored articles on oncology navigation in the Journal of Oncology Navigation and Survivorship, a chapter in the book Case Studies in Nurse Navigation published by the Oncology Nursing Society, and presented a poster at a national conference of the Academy of Oncology Nurse and Patient Navigators. Debbie is passionate about educating, empowering, and advocating for patients. So thank you, Debbie, for joining us, and I'll go ahead and pass it off to you.
Great. Thanks so much, Katie, for giving me this opportunity to come and talk with you all about oncology patient navigation. It's obviously something I'm pretty passionate about. So, okay. See if I can get this cursor to work. Here we go. So our objectives for today's talk are to obviously discuss oncology patient navigation, and also to talk a little bit about our program here at Northside, our team members, their roles and their functions. We're going to discuss some ways that oncology patient navigators can assist patients and their caregivers. And we're also going to be talking about a case in which a patient was navigated in the Northside system. So I don't have to tell anybody on this call that there are 3 life-changing words that patients do hear when they receive a diagnosis of cancer. And this cartoon kind of depicts what patients may feel and see and experience when they hear those life-changing words. You can just imagine some things that this describes. Patients feel lost, alone, fearful, anxious, worried, not even sure where to go to next. And so obviously some common reactions are feelings of helplessness, like I said, anxiety and fear, feeling lost, feeling uncertain, and just feeling overwhelmed and not even knowing where to start or who to go to for help. Some common questions we often hear are, gosh, what's going to happen next? Or what should I do next? Where do I go for reliable information? Who can help me understand my care? How am I going to manage life and my responsibilities in life? And how am I going to pay for this? Who can I talk with about my concerns? How am I going to tell my loved ones? And how am I going to tell, or even should I tell my employer? So that's where oncology navigation kind of comes into play. Oncology navigators can be a specialized point of contact with patients and caregivers. And we often serve for providing information, support, and connection to resources for patients and their families and caregivers during cancer care. So a little bit about the background of oncology navigation. Dr. Harold Freeman is considered to be like the founding father of oncology patient navigation. Dr. Freeman is a retired surgical oncologist in New York City. He worked at Harlem Hospital in New York and was actually past president of the American Cancer Society. He developed an approach to address the heavier burden of disease in low-income population that he served at Harlem Hospital, and established the Harlem Patient Navigation Program in 1990, which was designed to reduce disparities in healthcare. And you can see a quote here. He says, in a publication. He says, I was really raring to go out and do what I could, but this was really somewhat of a shock to me, having been trained to do all this cancer work, and then I'm facing late stage cancer that's too late for me to be effective technically. So he was obviously quite frustrated by what he was finding when he started to practice. So he developed, like I said, a navigation program which consisted of navigators who were from either the community or culturally similar to the population he served at Harlem. And the navigators were trained in a particular cancer care pathway that the patient should follow to complete their care. And the outcome is that his navigation program was able to demonstrate a reduction in racial, ethnic, and poverty-driven disparities in care. So fast forward from 1990 to today. So over time, the role of the Oncology Patient Navigator has evolved and expanded, and it assists people now from all areas of socioeconomic backgrounds and follows them along the continuum or steps of their care. So what is oncology patient navigation? So there's been various definitions. A standardized definition was developed by the Oncology Nursing Society in 2010. And it's pretty wordy, but I'm going to go ahead and read it. It states that oncology patient navigation is individualized assistance offered to patients, families, and caregivers to help overcome healthcare system barriers and facilitate timely access to quality health and psychosocial care from pre-diagnosis through all phases of the cancer experience. So if you have ever received care in another facility, you will quickly realize that there are various models of patient navigation. And these models are pretty much based on the needs of the particular organization and the population it serves. So some organizations only employ nurse navigators, licensed navigators. Others only use non-clinically licensed patient navigators, also called lay navigators. Other organizations like Northside Hospital use a blended model. We have both types of navigators. We have clinically licensed nurse navigators and non-clinically licensed lay navigators, which we call cancer care liaisons within the Northside system. So navigation may take place by face-to-face meetings, by phone calls, by emails. We do all three types of navigation within the Northside system. I can tell you during the past few months during the COVID-19 pandemic, I have been on the phone with various programs across the country, and almost all of them have primarily gone to phone calls and emails because they've been working remotely, which has been a struggle for those navigators who are normally used to face-to-face meetings with patients. So there's a pretty well-known saying within the navigation community, and it's, if you have seen one navigation program, you have seen one navigation program. Because again, it's based on the needs of the organization and the population it serves. So like I said, if you have received care in another facility and have encountered navigators in another facility, your experience may be different in that facility than your experience at Northside or anywhere else. So let's go ahead and talk a few minutes specifically about our program here at Northside. So we have our own oncology navigation program definition. Our definition is that we are an oncology support service that uses a patient-centered approach in collaborating with patients, families, and caregivers as they negotiate the maze of treatments, services, and potential barriers through their care. So you see that I've bolded and italicized some words, and those are some key concepts that we're going to be talking about in a few minutes that kind of explain a little bit more to support our program definition. We also have a mission and a vision in our oncology navigation program at Northside. Our mission is to guide patients, families, and caregivers to inform decision-making, collaborating with multidisciplinary teams to help overcome barriers to timely screening, diagnosis, treatment, and supportive care across the cancer care continuum. And our vision at Northside is that patients, families, and caregivers who receive or seek care at Northside Hospital will have access to navigation services across the continuum. So let's go ahead and talk a few minutes about the concepts I mentioned earlier in our definition. So concept number one that was bold and italicized is person-centered care. So some characteristics of person-centered care is that the care is coordinated and it is appropriate and continuous. That is respectful, like, listening to somebody's needs and respecting their personal values and their preferences, and providing that individualized education that people need, not just kind of a rubber stamp type of education, and providing emotional support. I stress that oncology navigators do not have certification in counseling, but we certainly do provide emotional support and take the time to listen to patients and their goals and their values and their preferences. We really encourage open communication and empower patients and family members for or towards open communication, not only with the multidisciplinary team, but also with one another, to help communicate those preferences and goals. Okay, concept number two. This surrounds assistance with needs and barriers to care. So our navigation program here at Northside is based on or built on a framework, a validated framework for cancer care. And that framework has 7 domains, or it's organized in 7 categories of care. And so when our nurse navigators receive a referral of a patient, they will go ahead and assess the patient according to these 7 categories of care. So the first category is an informational barrier to care. So these are things like, understanding your diagnosis, getting more information. Who do I turn to for information, or who do I turn to help me understand the information that was relayed by my physician or healthcare provider? Information about the disease, the treatments, the tests. Certainly the medical terms and jargon that people hear. It's almost like a foreign language in some cases. And then how to navigate the healthcare system. I mean, good gosh, it's hard enough to understand all this information, but then also how to move through and get care throughout the system. And certainly at Northside, we have not only 3 campuses at Cherokee and at Atlanta, and then at Forsyth, but we also then have the Gwinnett system. And then we have patients that come to us not only from within the state, but all states bordering the state, and frankly all over the nation. And we even have patients come to us internationally. So navigating the healthcare system is very important and can be a barrier. So a social category or domain of care. So those are things like, support system. If the patient doesn't have a good support system, or if their significant others or their family members live far away and they're here alone in Atlanta. We have patients who have different cultural beliefs and beliefs about how they want to receive care. Role alteration. If you're the primary breadwinner of your household, how is that going to affect you? Communicating with others regarding your diagnosis and goals. I mean, this is a huge area that we can assist with, and sometimes we even role play with patients on how that physician visit's going to go when they need to make sure that they get information, or patients need to get information across to physicians in a timely manner, within that visit. Practical needs. These are typically needs that people often will identify with navigation. So problems with activities of daily living. Oftentimes patients will be totally independent when they first start cancer care, but throughout their treatment, they may develop some side effects, or may develop some ongoing fatigue, some pretty extreme fatigue, that all of a sudden meal planning, meal preparation, house cleaning become more of a struggle. And so there are resources to help with that. Gosh, who's going to take care of my cat when I go in the hospital to have surgery? Who's going to take care of my elderly husband, or my spouse who has Alzheimer's and I'm the primary caregiver for that person? What am I going to do? And so these are some of the things that we help patients with. Obviously, finances and bills, lack of insurance, housing. We have patients who come to us who are either in transitional housing or who are actually homeless, and so we help to address those barriers to care. Food and clothing, that really seems pretty basic, but I will tell you the number of referrals from, during the pandemic have really skyrocketed, not only with us, but also with navigation programs across the country as patients have either been furloughed or lost their jobs. Supplies, transportation, and transportation is not only connected with or to patients who have financial assistance needs, because we have patients that either can't drive or either don't drive or are unable to drive due to their cancer diagnosis. Living conditions, language, that's a big barrier, distance to care. So physical, that's another obvious area. Disability, fatigue, insomnia, nutrition, fertility, particularly with our younger patients. Emotional barriers to care, like that first slide I showed you that depicted just sometimes a diagnosis of cancer stops people in their tracks, and they're paralyzed with fear and having trouble coping and figuring out what to do next. Psychological domain, these are things, body image disturbances. People sometimes lose their hair during treatment or maybe are disfigured post-surgery. And so we address those areas, as well as spiritual distress. And like I just mentioned, people are sometimes, just really stopped in their tracks with a cancer diagnosis. Their life has gone on, and all of a sudden it causes people just to kind of review what's meaningful or what's not meaningful in their lives. And so we do address these areas as well and connect patients and family and caregivers with resources for spiritual needs as well. I do want to point out that physical assessments are performed by oncology nurse navigators. Obviously, they're the ones with the licenses to perform clinical assessments. So the third concept in our definition of our program here at Northside is continuum of care. So navigation can enter any area in a patient's continuum of care, oftentimes called a patient's journey. This is kind of what separates our oncology nurses and our navigators from other members of the healthcare team. For example, oncology nurses can practice in an inpatient setting, an infusion setting, medical oncology office, radiation oncology, but they interact with patients during one episode of their care. Whereas our nurse navigators interact with patients along any point in a patient's continuum of care. So that's why it's extremely important that our nurse navigators are very specialized in understanding a patient's particular disease site, so they understand what their treatment may look like along each area of the continuum of care. So I'm going to talk a little bit about our oncology patient navigation team here at Northside. First of all, we have oncology nurse navigators. They're registered nurses with oncology experience and advanced training in an assigned disease site. So we have 2 breast nurse navigators within our Northside Atlanta location, and we at Gwinnett, there are also 2 breast nurse navigators. In our Northside system in Atlanta, we actually have an open position for our lung navigator. And then the Gwinnett system also has a lung navigator within the navigation department. We have navigators in our GI disease site. So those are diagnoses such as colon cancer, rectal cancer, liver cancer, pancreatic cancer. We have a GU navigator that's genitourinary. And so those are that would cover disease sites such as kidney cancer, bladder cancer, prostate cancer. We have a nurse navigator who specializes in GYN cancers. So those are cancers such as ovarian, endometrial, cervical. We have a neuro nurse navigators, so that's primarily brain and spinal cord cancers. And we have a nurse navigator who specializes in melanoma and sarcoma, which is skin cancer and soft tissue cancers. And as I mentioned earlier, we have non-clinically licensed lay navigators. We call them cancer care liaisons within our Northside system. And they have specialized training in oncology and real expertise in patient resources. I mean, these are the folks on our navigation team that we turn to for resources. They are our go-to people, and I cannot say enough about them. We have cancer care liaisons who are located at our Atlanta, Forsyth, and Cherokee hospital campuses, as well as specific medical oncology offices within our region. So a little bit about what each of these team members do. So an oncology nurse navigator serves as a primary resource and point of contact for patients. They provide education, they identify and help patients overcome barriers to care. They support and guide patients and caregivers to their next steps of care, particularly in those critical transitions from, say, for example, medical oncology to survivorship, or from diagnosis to maybe to a surgeon and that kind of thing. They connect patients and caregivers to resources and support services. And then our cancer care liaisons help patients and caregivers with practical needs and barriers to care by connecting them to resources. And as I alluded to a few minutes ago, they are really our resource experts and have to stay on top of the resources, because oftentimes these resources come and go. They're largely supported by grants and foundation funds. And oftentimes that funding does run out of money throughout the year, so they really have to know what's available. And these are, you know, as I mentioned before, these are just practical needs that are not only associated with financial assistance and transportation, but things like pet care and lawn services and so forth, those needs that patients do find that they run into along their cancer care continuum. And the grants and foundation funds, the resources are also often either national or regional or local. I mean, just kind of wherever we can find them. So this map does depict, it's kind of like a footprint, I guess, of our locations of our navigators across the Northside system. It does not include Gwinnett as of yet, but like I mentioned, Gwinnett has 2 breast nurse navigators and a lung thoracic oncology nurse navigator. And then, so for the Atlanta campus, we have myself and Keisha Jennings are the 2 nurse navigator supervisors. And we have a total of 8 nurse navigators within the Northside footprint on this map. And they are depicted in the, I guess it's an orange or gold color square or box. And then our cancer care liaisons are depicted in the blue boxes. Like I said, we have them located at all 3 campuses, as well as select medical oncology offices across the state. So I'm often asked, how do we find out about navigation? So as patients enter the system, they're going to physician appointments, or perhaps coming from an outside clinic, or perhaps even through another support system, such as the cancer support community, or oncology rehab. And so oftentimes that's primarily how we find out about patients. We do look through various reports, such as surgery reports. So we find out about patients through oncology social workers. We have a call center for the Northside Hospital Cancer Institute, and the call center nurses will ask patients if they would like to receive a call from navigation, and oftentimes they do, so we are connected to patients through the call center. We have disease site multidisciplinary conferences that are attended by physicians of all different types of disciplines and other support services, and our navigators are involved in these multidisciplinary conferences and are often referred, patients are often referred to us in the MDCs, as we call them. Obviously inpatient units, family and caregivers, we often have patients just calling us themselves and say, hey, I'm really stuck and I'm not sure where to turn to, and I was really hoping to get some help. I'd mentioned community clinics, radiation oncology. Sometimes even patients are not sure where to turn to and end up calling patient relations or other internal departments within the system. So how does our navigation flow look like? So this upside down pyramid, I guess you can say, inverted pyramid, kind of depicts how patients flow through. So you have 100% of people entering the system, and so everybody, wherever they enter, whether it's a surgeon's office or another professional's office, is going to be assessed. And they're going to be provided with education. And then additionally, some people may need additional education, information, help to navigate the system, as we talked about earlier. Maybe they would like to have be connected with support groups, such as through the cancer support community. And as you can see, as you move down through the inverted pyramid, you can see that we do work with patients at the bottom who really do have quite a number of needs and whose acuity level is pretty high. And so you'll see in a minute, we're going to talk about one of these cases. I'm going to give you a little bit of background on this patient that was navigated by one of our breast nurse navigators here at Northside. So within the Northside system, any patient who has a biopsy and a positive diagnosis from that biopsy of breast cancer will, the path report is faxed to our nurse navigators. So we basically receive referrals from our radiologists within our Northside system. So our nurse navigator received the pathology report from our Northside Imaging Center. The patient was 43 years old, and she was diagnosed with breast cancer. It had spread to her lymph nodes. So our nurse navigator called her and performed that initial assessment. We talked about the 7 domains of our supportive framework, and she did determine several barriers to care, and you're going to see these listed out, and you're going to see that she was connected with 20 different resources. So the barriers to care in the domains that were identified in the informational domain, she really had a need for reliable and understandable breast cancer information education. As you may or may not know, there are many types of breast cancers, and so in order to understand what her treatment pathway was going to be, she needed to have a little bit more information about the type of breast cancer she had. She was really highly emotionally distressed. Really, if you remember back in that first slide, she was literally frozen in her tracks and had trouble coping and making decisions about her next steps, which is not unusual at all for anybody who receives a diagnosis of cancer. In terms of the social domain, she didn't have a lack of a support system, but she lacked a local support system. All of her friends and family were located out of state, and actually communicating with other people, due to the different time zones, and also just having trouble even, due to the fact that she was having trouble coping and understanding her diagnosis. She also was single, and so she was the sole supporter of her household, so there was some role alteration needs there. And then she had a fair amount of practical needs. She had trouble with grocery shopping and pet care and getting those resources to assist her in doing that. She was obviously employed and needed some assistance with how to, or should she discuss her diagnosis with her employer, and how is she going to, or should she take off time during her treatment, and then finances and bills, since she is having to deal with employment, and also since she was the sole supporter of her household. She was experiencing some fatigue and worsening symptoms. And so the next two slides depict the various resources that the navigation team, and I say the navigation team because we had not only an oncology nurse navigator working with her, but also a cancer care liaison working with her. So I'm going to go through these rather quickly because there are 20 of them. So we provided her with verbal information and some written materials. We connected her to the Caring Bridge website so she can communicate more effectively with all of her family and friends who are located all over. So she didn't have to take 20 different phone calls and repeat the same story 20 different times each day. We connected her with the Cancer and Careers website. It is, I cannot begin to tell you how chock full that website is of information. If you are employed, have been employed, or thinking about returning to work and have had cancer, I would highly recommend you access this website for some guidance. It's tremendous. So the cancer support community, we connected her with the cancer support community and provided her with some specific information with regards to support groups and classes, which were specific to her. We connected her to the wellness place. Her treatment was going to cause her to lose some hair, and so we connected her with them regarding a wig. We also connected her to 3 areas that may help her for emotional support, the oncology social worker, our behavioral health department, and also her employer assistance program through her employer. Cleaning for a Reason is a resource that assisted her during her treatment with housekeeping. We connected her with Northside Hospital financial assistance and also a myriad of other financial resources, as you can see here. And also for her social and emotional needs, we also connected her with our Network of Hope and Camp Hope. And then for her physical needs, especially for her fatigue, we connected her with outpatient rehab. So over the course of the 10 months that are so far recorded for her, our navigation team has had 49 patient encounters with her. So that would be face-to-face meetings, phone calls, and emails. So in addition to patient support and direct patient kind of care, our oncology nurse navigators also have other responsibilities and other functions. So they are active participants in our multidisciplinary cancer conferences, which I mentioned earlier. They are disease site conferences that are held, like I said, with physicians and other members of our support team. And so they have to prepare reports for and attend what we call the MDC conferences. They also attend interdisciplinary team meetings that happen on a regular basis, whether they're research meetings or steering committees for the disease site. They coordinate care. There's a fair amount of communication and coordination of care with members of the interdisciplinary team. And they also work with the interdisciplinary team for program accreditations. So some of you may know that Northside is accredited with certain programs such as the Commission on Cancer, NAPBC, and the lung disease specific site certification. So our nurse navigators are intricately involved with those as well. So how do you get in touch with a navigator? We have a main navigation line, and you can see on here the number is 404-300-2800, and you can call us, leave a message, and someone will call you back and connect you with the appropriate person. You can email us. That is monitored, pretty much on an ongoing basis. I see it pop up whenever we get an email on my screen, really in real time, within seconds. Also, if you would like to contact me, my information, my email information is debbie.bickes, B-I-C-K-E-S, @northside.com. So, just like to turn it over to all of you all for questions.
Thanks, Debbie. I don't know that everybody has a good understanding or, has an awareness of all that you guys do. So I think this was really helpful to see the resources that are available to people through the nurse navigators and the cancer care liaisons. And it's impressive how many resources you guys have in your pocket for sure. So I'll start with this first question. How do I know when to contact my oncology nurse navigator versus my doctor? And do the two coordinate with one another?
Oh gosh, that's a really good question. So, obviously for physical symptoms, new or worsening symptoms, we encourage patients to always connect with their doctor's office. Remember, we are a support service. We are kind of that additional layer of support, but we, obviously it needs to be the doctor. So, but we have had patients in the past who have called us with concerning symptoms, and they weren't sure if they should report the symptom to the physician. Patients tend not to want to bother their doctors. And so sometimes we have, had to encourage patients, yes, please call the office. Sometimes patients will call the office and, haven't heard back. And based on the symptom and what is being reported, we have had to, specifically instruct a patient, okay, this is what you do to get in touch with somebody. And I'm going to call you within X period of time, whether it's 15 minutes or 30 minutes, and make sure that you have either talked to somebody or that you have heard from somebody. And then oftentimes, depending on the seriousness of the reported symptom, we will then go ahead and call the physician's office and say, I just want to make sure that you have heard from this patient. They are trying to get in touch with you. This is what's going on. So we work really hard if there's something that's a concerning symptom or new symptom or worsening symptom to make sure that patient gets connected, but we prefer that the patient connects primarily with the doctor's office. Now, having said that, we do coordinate a fair amount with physicians' offices. Oftentimes, if there's something that we feel like, we need to share with a physician, we coordinate, like I said, we even sometimes role play with patients on how to talk with their physicians. We don't want to be the relaying of the information. We want patients to communicate directly with their physicians or the healthcare providers. We want to empower that relationship and strengthen that relationship. But sometimes patients are not sure how to do that, and so we help them prepare maybe a list of questions and things like that. As I had mentioned before, Northside is a large referral center. So sometimes, patients are here in Atlanta. I can think of one case somewhat recently where a patient was here in Atlanta on business, ended up going to the emergency room and ended up being diagnosed with cancer, having surgery, and then had to go back to his home area. And so connecting, making sure that patient was connected to care within the home area, and then getting back with a surgeon here in Atlanta and just saying, yes, this is who he's seeing, and this is the appointment date, and so forth. So yes, we do all of that.
So it sounds like you guys are, maybe their doctor's office is the first line of defense, but you guys are definitely a useful resource.
Yeah, and a lot of it depends on the concern or the question. Oftentimes, I can just remember instances where I've had phone calls from physicians' offices who will call and say, you know what, I just saw a patient and I really think that they would benefit from you just calling them and kind of talking through things and kind of reinforcing and so forth, or just making sure that they do have access to care and come back for whatever reason. So yeah, there is back and forth coordination.
Good. And I know that's always helpful for patients because then you're not reiterating the same thing several times. It's nice to have people coordinating care. All right, so the next question is, can I still contact the Oncology Patient Navigation team for survivorship-related resources if I'm post-treatment?
Absolutely, absolutely. And as a matter of fact, studies have shown, and my experience is also been that patients, you know, when they go into the survivorship mode, you know, if they're ending treatment, whether it's, you know, medical oncology treatment or radiation, and then they go into the survivorship where they're just being surveilled every 3 or 6 months, that's a real time of stress, because, you know, you have that literally that cocoon of a medical team there on a regular basis, and all of a sudden it's like, you know, you're graduated. And so I think reaching out to navigation, particularly if you're feeling lost or needing some connectivity, is a great thing. And yes, we do connect with patients along any point in the continuum of care.
Okay, great. And I think one of the questions was, how do we know which cancer care liaisons or nurse navigators are assigned to each geographic territory? Would it just be calling that call center and them connecting?
So the best thing to do, I mean, you can certainly connect with navigation through the call center, but the best thing to do is to call our navigation line, that number 404-300-2800, or to email navigation at navigator@northside.com. And then we will connect you with the appropriate person. Our program is set up by disease sites. So for example, if you have a diagnosis of breast cancer and need to be referred to a breast nurse navigator, we know exactly who to send you to.
Okay, thank you. And I think this kind of speaks a little bit to some earlier slides in the presentation. I've been assigned a case manager within the hospital system where I'm receiving treatment. Is this the same as an oncology patient navigator?
Oh, that's a really good question. And we actually have to delineate that during our orientation of our navigation team as well, just to make sure that everybody kind of understands, you know, what their roles and their boundaries are. So a case manager in the hospital addresses needs for patients who are admitted in the hospital and are the primary discharge planners. So for example, if a patient is in the hospital and then needs to be set up with some home health services, the case manager is the primary person who, or is the person in charge who sets that up for patients and connects patients to that. Or if they need any particular supplies, maybe home, you know, if it's a patient has GI cancer and they have a tube, a peg, what we call a peg tube, then they set them up with, you know, tube feedings and equipment before patients go home. We primarily, navigation primarily works in the outpatient setting. So I guess that's how you can kind of distinguish between the two roles, is that case managers work specifically with patients when they're in the hospital. I know previously I started at Northside as a breast nurse navigator, and so when I was a breast nurse navigator, I had a patient call me and ask if they could go ahead and set up home health services for you know, post-discharge. And so I connected with case management, and until the patient is actually admitted and has a surgery, they will not be able to address that, because they need a doctor's order and they actually need to do an assessment to see what exactly is needed before they can actually set that up with a home health company. So you hope that kind of explains the difference. I mean, certainly once patients go home and a new need pops up, you know, we can, patients are welcome to call us. Sometimes we have had to actually reconnect with the case manager in the hospital if we find out that services that were arranged, you know, if the company didn't contact the patient or was having trouble contacting the patient.
Okay, and kind of going back to the previous question about nurse navigators for each location, it sounds like the resources you send are pretty specific to geography. Sounds like, so you connecting them to local resources, is that right?
Okay, so it depends on the need. For example, okay, so for our nurse navigators, the resources are more of a clinical nature, and so there's not as much connectedness to geography, although we do So for example, Dee Jones, who is our nurse navigator in Cherokee, on the Cherokee campus, primarily navigates patients who are referred to her within that area. But that's not to say that she cannot speak to a patient with a particular diagnosis, because she is a nurse navigator. She's a nurse. But in order to manage the caseload, we do break them up primarily by geographic location. With our cancer care liaisons, it is more of a geographic location, primarily because the resources that are used, many of the resources are local resources, and so they know the resources that are in their particular area that they serve.
Okay, I think that's very helpful. And I will remind people, you said the navigation main line, that's 404-300-2800, or they can email navigator@northside.com. And also want to remind folks, if they're interested in connecting to any other oncology support services, to please contact Cancer Support Community Atlanta through our website, cscatlanta.org, where you can see a complete list of programs like these education programs. We also do stress reduction and nutrition programs as well on there. So I think we're probably wrapping up. I don't know, Debbie, if you have any closing remarks you'd like to share.
Well, some feedback here. I do want to say thank you so much. I think, to kind of tag on a couple of those questions that were asked, it's really I would just recommend that people not worry about the various demographic locations. If you need a nurse navigator or a cancer care liaison, or if you're not even sure who you need, just reach out and call the navigation line, because we'll know how to help and connect you to the right person and the right area of your need or barrier to care. But having said that, I really just want to thank Katie and the cancer support community and all of you all for your attendance and your attention today. And I look forward to hearing from any of you if you need to contact me directly. Thank you.
Thank you, Debbie, for today's presentation and for all you and your team do in connecting people to the resources they need. I know it is much appreciated. All right, thank you everyone so much. Take care.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org. Or follow us on Facebook. We'll be sharing additional information on upcoming programs.